Welcome to Koreatown. Established in the 1970s as a safe haven for incoming Korean immigrants, Koreatown served and continues to serve as a gateway for those looking to make Los Angeles their home. The dense urban neighborhood includes a diverse range of working class individuals. Due to various social, political, and economic barriers, many face obstacles that prevent them from accessing the care they need. So, what does health and wellness look like in K-Town? Let's find out.
Healthy is definitely a state of mind. You have to be physically healthy, spiritually healthy, have positive self-talk, and obviously take care of your body. So the mind-body connection, really making sure that you have a good community and you obviously are taking care of yourself the best way possible.
I feel like my health needs are met so far. I don't have a lot of extreme health conditions yet.
But every 3 months, I visit the doctor, check my health.
And is it here in Koreatown?
Yes, Koreatown.
My primary care provider is not here in Koreatown. They're actually a little bit further away. It's Kaiser Permanente, which is very comprehensive, but it's not to the quality that I wish it was. K-Town is a amazing place filled with diversity. There are so many different people from all different walks of life. There are a lot of excellent places that do speak Spanish and Korean in this neighborhood. So I think that people do have the ability to get care as necessary.
There's a lot of issues with language barriers, but in terms of our clinic, we have solutions for that. We have a lot of employees who speak different languages like Korean, English, Spanish. We have Thai representatives, and we also have Bengali speaking staff too.
We visited Kheir Clinic, the only FQHC in the nation that offers a full suite of services in English, Korean, Spanish, Thai, and Bengali. There, we chatted with their physician, Dr. Ida Tuwatananurak, and physician assistant Angela Kim, who gave us an insight on what health and wellness looks like in Koreatown.
I think a large part of primary care starts at home, and understanding, how they were raised, the foods that they eat, the lifestyles that they have, because a lot of preventative things start, at home and at the root. Patients that are at our clinic are largely immigrants, and they're not familiar with our healthcare system at all. And so helping them navigate that in a different language presents itself challenging, but we're so lucky that we have a patient resource department that can help the patients navigate that, help them make appointments if needed, and teach them how to use the interpreter line to advocate for themselves.
It's really important to understand where they're coming from and their culture as well. For example, for my Korean speaking population, a lot of them have medication hesitancy. And that's not so much because they don't really understand or have a lack of knowledge. It's either because we depended on herbal medication or homeopathic medicine to treat certain diagnoses and not so much jump to pharmacotherapy to help treat hypertension or even the basic, diabetes and high lipids.
Patients at Kheir Clinic come from a wide variety of demographic backgrounds. Dr. T and PA Angela share how they work with patients to meet them where they're at and navigate the healthcare system together.
A lot of the times, because culturally, like we kind of had discussed before, they actually prefer to make some lifestyle changes prior to depending on pharmacotherapy. A lot of the times, they actually inquire that first, like, hey, is there actually non-medical types of treatment that I can do to fix my high cholesterol or my pre-diabetic numbers?
We do have some patients that rely on food pantry and WIC. Luckily, we work across from the Karsh Temple. They do have food pantry services twice a week. And I have had to refer a few patients to get their groceries or whatever supplies they can get from there. But then also recognizing how challenging it is to take what they're given and make a meal out of it also, and something that in their culture that they eat and they're used to, because the ingredients that they get aren't necessarily what they're used to eating every day. And so I've had patients tell me, even though they have access to food pantry programs, it's not as helpful for them because they don't know what to do with it. And so sometimes, we're doing like on the fly Googling, okay, what can you make in your country's like diet that can use these ingredients? It was kind of fun to do that with the patients. It takes time, but that's how you build the relationship with them and help them.
With Medi-Cal or Medicaid, each health plan offers transportation services, and I do recommend most of our patients to utilize those services because they're there for that reason exactly. There are other like public transportation services like Access. That there's transportation for especially seniors who can't get by just on walkers or wheelchairs.
While there are tools to help mitigate the barriers patients face in the community, a large array of challenges still exist that complicate access to care. Dr. T and PA Angela share some examples to implement on a daily basis to help overcome these obstacles.
So we had to get creative. I became very good at using GoodRx, which if you have to pay for medications cash, like it's a discount card, patients can figure out which pharmacy they want to go to and figure out other ways to treat these chronic things that they do need specialty care for.
Because a lot of the times our patients are continuously seen here, but they have to be appointed to a specialist who may not speak their mother tongue, or maybe they're moving and so they're going to a different clinic. Sometimes things like that happen. So I do the best that I can to give them the tools to succeed at a future appointment at a specialist or at a different clinic so that they can ask the right questions and they know which, treatments and medications to be continued on.
Our experience in Koreatown sheds light on the health disparities that exist in the communities around us today. Despite existing healthcare barriers, Kheir Clinic demonstrates a system that advocates for all patients and transcends the barriers of language, culture, and the fear of being treated. As future healthcare providers, it is our mission to appraise the social, political, and economic factors in one's life to deliver quality care for all.
Come work, come serve your community, come to the underserved clinics. It's great, it's meaningful, and as much as you will teach your patients, I think you will learn a lot from your patients too.
I hope that if you come to this area, you have enough staff that's able to see patients, and hopefully you can help make this world a better place.
We take care of multi-generation families here, which is also something special in primary care. Representation matters, especially for minorities.